Hello, my name is Ian Appleyard. I'm the Research and Policy Manager at the British Acupuncture Council. Recently, there have been press reports about a study that looked at different treatments for lower back pain, with the conclusion that only 10% of non-surgical treatments actually reduce the pain. So I want to explain a little bit about this study and why we feel the analysis is not strictly accurate. So here's the original study. The main thing I'd like to focus on is it is a study that looks at randomized placebo-controlled trials. So here are some basic assumptions about a placebo control. Firstly, it is controlling to find out whether the therapy is not purely about psychological placebo effects. An assumption is that the placebo is inert, that it doesn't actually have any active therapeutic benefit, and normally people anticipate that placebo effects are short-term. If you look at the study, yes, it is acupuncture versus placebo, but other terms are used, particularly sham acupuncture. And if you look back at the original studies, you will also see something called minimal acupuncture, and we have to look at why this is. This kind of review is like comparing the results of separate races. So you have acupuncture versus placebo and then medication versus placebo. What study authors look at is to measure the difference with placebo and compare that to the other races. So that difference is known as the effect size. The study authors will also look at the quality of the clinical trials, and if the clinical trials are of poor quality, we can't be confident in the result, so that therapy will not be recommended. However, there are other trials that we can do, and that is comparing acupuncture to existing therapies such as medication. And what we see is that placebo acupuncture and acupuncture outperform existing therapies, especially a big study that was done on knee pain. So this creates a problem. How do you explain that? Why is placebo in two different places? The thing is that placebo acupuncture is really, or should be better known as minimal acupuncture, because it is an active treatment. It is not inert, as we once described placebos. Actually, a very large study published in 2018 demonstrated that acupuncture is not a placebo. Not only that, that the benefits of acupuncture last for at least a year. That study looked at a number of conditions, including chronic lower back pain, but headaches, shoulder pain, and osteoarthritis as well. The study did suggest that acupuncture has a moderate effect in the reduction of chronic and acute pain. First thing to note is that none of the therapies they looked at in this study actually had a large reduction in pain. Moderate was as good as it gets. Plus, remember that the sham acupuncture is an active treatment, so we could look at it like the sham acupuncture is running faster than some of the other placebos. Now, the study didn't recommend acupuncture because of the low quality of evidence, or what they perceive as a low quality of evidence, so they could be unsure of the conclusions. But as I say, the Vickers et al. Study had looked at chronic pain, in particular back pain, shoulder pain, headaches, and osteoarthritis. And because they had more clinical trials to put into their analysis, they could be more sure of the results. So we can be very sure that acupuncture is not a placebo, and it does have real clinical benefits. The study also showed that other therapies such as heat and dry cupping may also reduce lower back pain. Traditional acupuncture includes moxibustion, a form of heat therapy, and cupping. So these can be combined together to enhance the therapeutic effect. If you're interested in trying acupuncture to find out whether it could be beneficial for you, please visit our website www.acupuncture.org.uk. The British Acupuncture Council is an accredited register of the Professional Standards Authority, so you can be sure of the professionalism and quality of our members.